6 Effective home remedies for gum disease. Gum disease, also known as gingivitis, is a common condition characterized by symptoms like persistent bad breath, red or swollen gums, bleeding gums, receding gums and loose teeth. If not treated, it can advance to periodontitis and lead to further complications. The primary cause of gum disease is poor oral hygiene, resulting in plaque buildup along and under the gum line. Plaque builds up when bacteria attach to the tooth and gum margins. Factors like smoking, hormonal changes, genetic predisposition, poor nutrition, stress, certain medications, diabetes and other illnesses also contribute to the problem. The simplest and most common way to relieve pain and discomfort from gum disease is to rinse your mouth with warm water mixed with some salt. Many more effective home remedies can be used to alleviate symptoms, treat gum disease and prevent further complications. 1. Hydrogen peroxide. Hydrogen peroxide works as a strong antibacterial agent that kills germs and fights gum disease. Plus, it helps whiten and brighten your pearly whites. Make sure you use the 3% hydrogen peroxide solution that typically comes in brown bottles, rather than the highly concentrated version. 2. Aloe vera. Due to its anti-inflammatory and healing properties, aloe vera has been found to be beneficial in dealing with gum disease. Being an antimicrobial, it also kills the bacteria that cause gum disease. Plus, it fights bad breath and heals mouth ulcers. 3. Cranberry juice. Cranberry juice is good for fighting gum disease and infection due to its high vitamin C content. A study published in the Journal of Periodontology has associated lower intake of vitamin C with higher rates of periodontal disease. 4. Oil pulling. Oil pulling is a traditional Ayurvedic technique that is excellent for oral care. It helps strengthen the teeth and gums, reduces plaque, and relieves bad breath. It is also considered good for overall health as it removes toxins. 5. Myrrh. Myrrh is good for treating gum disease and maintaining proper oral hygiene because it has antiseptic, antibacterial and astringent properties. It is often recommended by herbalists as a remedy for sore gums. 6. Tea tree oil. The anti-inflammatory properties of tea tree oil help soothe irritated and inflamed gums. A study published in the Australian Dental Journal in 2008 found that topical application of a tea tree oil gel helped reduce gum bleeding and gingivitis. It did not reduce plaque though.